This is my CNA mind map. And first thing we're going to go is with nutrition. You have to encourage patients to eat and take in fluids. And another thing is feeding. Some will need essentially feeding, others won't, but that might be a role. Observe and report. You observe and report what they eat and what they don't eat, what they prefer, how much they're eating, how much they're not eating, the fluid intake. Another thing is providing privacy. Some residents like using their lunch, breakfast, and dinner as just times to interact with their friends, and they don't want to be bothered. Another thing is the diet plans. Some will have some specific diets, and another thing is food preferences. You have to make sure that that you attend those preferences and let them have some say in what they can and can't eat. Also, diet cards. Having the right diet card with the right person is really crucial because some are on specific diets and others aren't. Our next thing is personal care and living space. Proper bed making is one of them. You have to make the bed because if it's too wrinkly, it causes pressure ulcers. Another thing is emotional support, being there for the person whenever they need it, being supportive. Also, another thing is having routines, having that person on a routine so they get used to the routine and it becomes a routine. Another thing is helping them with activities of daily living. Another thing is encouragement, encouraging them to do their personal care on their own as long as they can. Also observing what they can do and what can do. If there's something that they stop being able to do. Also comforting them if that does happen. Just letting them know that setbacks happen, but there's recovery. Another thing is providing privacy. If they would like privacy while doing their personal care, you should give them privacy. Also individual preference. It's like while doing their hair, you have to consider their preference on how you do their hair, not just do it. Another thing is residents of an adult care home. Acceptance is accepting everyone, no matter how they identify themselves, their religion, or spiritual beliefs. You gotta accept everyone, even if it's not what you believe in. Promote independence. Let those people do stuff on their own. Another thing is comforting them if they ever do need comfort, if anything does happen, like loss of a loved one. Also praising those achievements. It's praising them and letting them know that they've done something good. The next one is dimension problem behaviors. It's explain what you're doing more than once, because some will forget, and you let them know, and because if you let them know constantly, it will prevent the problem behaviors. Because if they know who you are and you repeatedly tell them, like introducing yourself repeatedly and the reminders, you're letting them know more than once who you are and what you're doing, and they won't be as scared. And also keeping a routine with them. Keeping a routine lets them know what they're doing every day, and it's easier for people with dementia to be kept on a routine. And also encourage them to write things down, like their routine. If they write down their routine, addresses, phone numbers, it's easier for them to remember. Also, removing triggers that cause the bad behaviors. You speak slowly and clearly, but still be respectful. Don't treat them as little kids. Encourage independence like you would anyone else. Work with each person as an individual like you would with anyone else. Don't treat them in a specific way just because it's a dementia patient. You report signs and symptoms like you would any other person if anything's to happen, like more memory loss, or you see anything else that's reportable. The next thing is admissions, transfer, and discharge. It's the nursing assistant is in charge of packing the residents' stuff, and you need to involve them in that packing so they feel safe and comfortable that their stuff is getting taken care of. A way that you do that, if they can't do it for themselves, it shows them the empty drawers, the empty stuff, and let them know that there's nothing else, that it's all there. And also emotional support. Maybe if they're getting discharged or even admitted, it's a new place for them if they're getting admitted. If you're getting transferred, it's going to be a new whole place for them. And discharge, it's that feeling of not knowing if they're ready to go home, but you have to be there and support them and let them know that they are ready to go home. Explain the day-to-day life when they're getting admitted. Explain how the process goes at the nursing home, what goes first, what time lunch is, and all that, so they prepare themselves. Prepare the room so it feels, you greet them when they come in, let them know that they're welcome. You answer any questions that they have when they get admitted. Or when they're getting released, because some of them might feel like they're not ready, but just encourage them and let them know the doctors say they're ready. Also, positive reassuring. You're reassuring them that they're ready to go home. Another thing is the packing. Personally, that's the role. It's just involving them in the packing, and you observe. You observe if they're coming in. Observe what they can do for themselves, what they can't do, and when they're leaving, observe how they were when they left, if they ever do come back, or if they're ready to go home. The next thing is rehabilitation. You have to encourage independence like you would anybody else. It's just a little bit more push because they're in rehab. Application and the care of them, and you have to apply the exercises, like the range of motion exercises. You have to perform those. You have to be sensitive because they are going through a hard time. They're recovering from an illness. You have to observe and see if there's any setbacks. You have to acknowledge those setbacks. You have to be patient because, yes, they are coming off of an injury or something. You have to involve residents in their care like you would anyone else. Be positive, supportive, and recognize the setbacks, like we said earlier. The next thing is comfort, rest, and end-of-life care. You talk to residents even though they might not answer back, because hearing is said to be the last thing to leave their bodies. You follow the care plan. You also provide privacy. Do not isolate or avoid the person just because you know that their life might end soon. You involve them in everything you can. There's also in hospice care, there's a turning point of what to focus on, and that will be pain and relief and comfort. Pain, relief, and comfort. Emotional and spiritual support is still needed. Respect their wishes. Do not force anything. Listening and offering help is one of the biggest things a nursing assistant can do in those times. The next thing we'll do is physical changes accompanying age. You have to assist with more things if they do need assistance. You have to be respectful. You have to help them adapt and adapt yourself. Have patience with the patients, because they are also, it's new changes for them, not just you. You observe and report any setbacks or any changes throughout that you've realized. You encourage like always, and you provide privacy. The next thing will be communication. There is nonverbal and verbal communication. Verbal communication will be like when they talk to you, writing, and all that. Nonverbal is like their body language. If some people, they will not be able to speak to you, so you have to consider those nonverbal communication. And also the residents. You'll communicate with the residents, with your coworkers about the residents and about the care plan and also with the family residents. You have to have communication with all those three branches. Infection prevention is our next one. The care plan and assignments is a way to prevent infections. You have to follow your care plan and the assignments. You have to wear your PPE, which is your gloves, goggles, mask, cap, your gown, and all that stuff to prevent. And then vaccinations. For hepatitis B, the facility most likely gives out a free vaccination, so you should take advantage of that. Also, follow facility policies when it comes to infection prevention, and also have standard precautions. In addition to that, have transmission-based precautions. The next thing will be mental health illness. Observe residents. As usual, you observe and see how they're doing, any setbacks, anything different that you've realized. You encourage independence like you would anyone else. You treat each patient as an individual as you would anything else. And you support the resident, their family, and friends. You have to be more supportive and be there for that person, because they might be going through something and they don't always know what is like going on with the illness. You have to make sure they know, and you have to inform them, being informative. And also, the next thing will be roles and responsibilities. Some of the roles and responsibilities, as you've seen all around, there's lots of different ones. Some of the main ones that I've seen is observe. Like you, in every single one, we realize you have to observe. You have to report and document also. You have to keep places neat and clean, like we talked about, for the proper bed making. You encourage them, like we have in every single one. And another thing is vital signs. You have to take blood pressure, temperature, pulse, respirations, weight, samples, and all that stuff is what you have to take. You have to promote independence like we have and assist with a lot of things like activities of daily living. The next thing we'll go to is safety and first aid. You have to make sure you know their policy on restraints. Some facilities are restraint-free facilities. Although your environment, make sure you are cautious and make sure there's nothing that they could trip on, fall on. Another thing is fall precautions, like clearing up your environment. You have to make sure of those. Fire hazards and the facility's policy on fire hazards, on what to do if the fire does happen, a tornado drill, and all that stuff. Another thing is body mechanisms. You have to be safe when in using your legs instead of your back when doing all lifts and all that stuff. Another thing is state laws and facility rules. Be aware of the state laws and facility rules when it comes to safety and first aid. Your next thing will be mobility. Mobility would go under positioning, which you have to know your different types of positions and how often you position a person, and also transfers, knowing how your facility does transfers and all that. Also maybe mechanical lifts, having to do those, learning all that stuff, and ambulation and being there for the person and knowing in their care plan if they have had a stroke and have a weaker side, knowing where to walk on and all that, and gait belts, canes, and walkers. Our next thing will be elimination. It's elimination. You can be assisting with toileting. Also, taking specimens and the different types of specimens, being informed of that. Also, knowing what to do with the equipment and where it can be stored and where it can't be stored. Also, taking input and output charts, and elimination would be the output of the chart. Also, cleaning and the facility policy when it comes to the equipment used, if they can't make it to the restroom. Another thing is catheter and the daily care of the catheter. Make sure that you know and read the care plan to how you're involved in the catheter, the daily care of the catheter, and also observe and report like you do anything else. The last one is our vital signs, which would be body temperature, pulse, respirations, blood pressure, pain level, and also you have to know your normal ranges and your vital signs, or their baseline vitals, which would be where they're steady and what's their baseline, and then changes in those from the baseline, and also provide privacy while doing vital signs and all that stuff.